Communications and Marketing with Camosun College. I'll be your MC for today's Zoom webinar. Before we get underway, I just want to run over some simple housekeeping information. It's going to run for about 1 hour. We're joined by Board Chair Monty Bryant, the college executive team, and special guest Dr. Murray Fyfe. He's Medical Health Officer with Island Health. We're going to start with Sherry, then remarks from Dr. Fyfe, followed by a brief Q&A between him and Sherry. And then remarks from the board chair. Then we're going to get to some pre-submitted questions. Thank you to everyone who submitted one. And we're going to answer live questions using the Q&A function. Now, I'd just like to turn over things to Sherry, please.
Good afternoon, everyone, and welcome to our third virtual gathering. I'd like to welcome everyone. My name is Sherry Bell, president of Camosun College, and I'd like to recognize and acknowledge the Lekwungen people whose traditional territories our two campuses reside on, where we live, work, and learn together. It's my pleasure to introduce to you Dr. Murray Fyfe, who's going to give you an update on the South Island and COVID. And then Murray Fyfe and I will have a conversation, and I'll ask him some questions that you submitted in advance. So over to you, Dr. Fyfe.
Great. Well, thank you, Sherry. Pleasure to be here. I just am going to, for a few minutes, just go over some of the current state of affairs with respect to COVID epidemiology on Vancouver Island, and then just do a quick review of the current strategies that we're using to control and prevent COVID. So I would say that our case rates were steady on Vancouver Island and low until about 4 weeks ago. And this all changed the week just before Remembrance Day, when cases started to double about every 8 days. So we were quite concerned. It looked like we were getting into a period of exponential growth. And much of this rapid escalation in our cases was fueled by an increase in social interactions around Halloween, coupled with travel back and forth to the mainland and other parts of Canada. And so this caused quite a few outbreaks around the island, including here in the South Island. And we're still seeing some of the ripple effects from that. However, we've been able to turn that around quite a bit, and for the last 2 weeks, our case rate within the South Island in the Capital Regional District has been 66 cases per 100,000, which is at least 10 times lower than other harder hit areas of the province, like Fraser Health and Surrey. So we're now have had about 6 health facility outbreaks on Vancouver Island, including the Saanich Peninsula Hospital, which is an ongoing outbreak, but it appears to be coming under control, and there's a lot of effort in place to ensure that that is the case. And I know this has an impact on some of our healthcare students through Camosun, so certainly something that's getting attention and concern from the college. And there have been about 16 exposures to date in public and independent schools around Vancouver Island, which have resulted in some children having to stay home for up to 2 weeks. But for the most part, we've been able to, again, control those fairly quickly and not have a large interruption in the educational experience of children and youth on Vancouver Island. So going forward, over the coming months, there are really 3 main strategies that we're going to be following to control the epidemic, many of which we're doing already. So first is to continue to make testing as available as possible to quickly identify confirmed cases and to follow up with their contacts. And access to testing on Vancouver Island in most of our communities is working very well. People with symptoms call the Island Health call center and receive a call back, usually within the same hour, and be tested, usually within hours, and get their test back, generally speaking, within 20 or 24 hours. And there are some new testing techniques that have come online and we're using or are becoming available, including the gargle test now, which has replaced the less comfortable nasopharyngeal swab. So that's our mainstay at this point in time, with a few exceptions. And we're also getting some quick tests and point of care tests, which will help us in some of our more rural and remote areas where it's harder to get testing out into a standard laboratory. Sorry about that. So our second main strategy is provincial orders, and these are coming primarily from the provincial health officer and the solicitor general, and are meant to prevent COVID spread. And so these orders have been changed. Every few weeks we've been noticing changes come through, and the changes are really based on the epidemiology, what we're seeing in different parts of the province. So the orders are related to gatherings and events, food and liquor premises, sporting groups, and physical activity restrictions, and the requirement to have workplace safety plans. And our environmental health officers from Island Health are continuing to work with all businesses and sectors to make sure that they are able to follow these orders and guidelines appropriately to ensure safe operations. And then, of course, the third main aspect of control and prevention that we're all anticipating is the start of immunization for COVID. And we are expecting COVID vaccines to be arriving very soon in BC. There are, expectations that we will have some vaccine on Vancouver Island by early January. There's dozens of vaccines that are in production or under trial right now, and 6 main platforms or technologies that are being used. And the federal government is investing in about half a dozen of these vaccines, which will be distributed to the provinces eventually. But in the short to medium term in BC, we're expecting vaccines from 2 different platforms, both basically the RNA vaccines and also non-replicating viral vector vaccines produced by 3 different manufacturers. And there's some advantages and disadvantages to these different vaccines in terms of how they can be used that we have to take into account. So I just want to comment, though, that all the vaccines go through reasonably rigorous stage 1 through 3 clinical trials that must demonstrate that they are effective and safe. And the results of these trials are then subsequently reviewed by countries independently, and we have a regulatory body in Canada that does this review prior to approval for use within that country's borders, so prior to use within Canada. So I'll just end then by saying that, but basically with these vaccines, this rather long tunnel that we've been going through does have some light at the end of it.
Thank you so much, Dr. Fyfe. I've got a few questions that have come in from our employees. The first ones are about vaccines, and just wondering if you've got an idea of the timeline of when we could see maybe the first vaccines arrive on the South Island, and where would you see them being administered? Is there a potential that Camosun could be a site to administer vaccines?
Well, yeah, it's kind of ironic that actually just as we're speaking, that a lot of the initial details about the immunization plan are being announced this afternoon by the provincial health officer and by the Ministry of Health. So I don't have all the details yet. I haven't had a chance to listen in on that or find out, but we will certainly, if you check what has been said this afternoon, we'll have a bit of a better idea. But what I do know is that we're likely to receive in the several thousands of doses on Vancouver Island by early January, based upon sort of the estimates that are coming into Canada and how much we can expect to be distributed. Some of the Pfizer vaccine, which is a vaccine that has to be refrigerated at ultra low, or I should say frozen at ultra low temperatures, is going to arrive in the Lower Mainland probably within the next week or so. And because of this ultra low freezing requirement, Pfizer does not really permit redeployment of the vaccine to other locations. So that initial vaccine will be used on the Lower Mainland most likely. And then we're probably going to get some vaccine on the island by early January. Again, it won't be large numbers of doses, but there will be limited amounts that come here. And we can get into more details, but I would just say that we're not looking at having vaccine go to an institution like Camosun College right off the bat, because of basically there's a whole series of prioritizations around who gets the vaccine first that has to be taken into account. And then there's also obviously some feasibility issues dealing with vaccines that have to be frozen to -70 degrees, that we can't just have them going out to all over the place. Yeah.
Another question that came in is, will vaccines, will the immunization be mandatory? In other words, will employees and students, in order to come back on campus, will they be required to be vaccinated prior to that time?
Yeah, well, that's an interesting question, and certainly a question that needs to be thought of at this point in time, because we are dealing with a very severe pandemic, and we do have something that we're quite confident we'll be able to control the pandemic safely. We have not really gone the route of mandatory immunization in BC. I know there are other jurisdictions that have done that, and the one place that it gets talked about is should immunizations be mandatory in schools, for example, public schools. And the approach that we've taken is to really, possibly in some settings require not mandatory immunization, but requirement to register whether you've been immunized or not. And the reason for doing that is if you do have an outbreak in a certain setting, it may be important that we exclude people who are not immunized or who are not immune in order to reduce the impact. So that's something that potentially could be considered, but I have not heard any discussion that there would be mandatory immunization, and that would be going in a completely different route than what we have gone in before.
Okay, thank you. Another question that came in was, what's your experience in dealing with people that think COVID is a hoax and vaccines aren't necessary? Don't believe the science don't
believe the science.
Yeah.
Yeah. Well, I would say that, basically it's important not to get into personal disputes over this type of thing. I think, I've seen some pretty nasty disagreements over things like mask wearing, and we've probably all witnessed that to some degree and read about it in the news. And I know the police have been involved in certain situations. So I would say that people have the right to their opinions, but people don't have the right to put other people at risk. So if it means, requiring immunizations when there's an outbreak going on, or requiring mask wearing, then in order to protect other people, like in our long-term care facilities, for example, then people have to respect that. And I would say that, when dealing with these types of situations, I think it's really important to stay with the facts. And we know that there have been, 68 million people who've been affected by COVID over the last 10, 11 months. So that's not a fallacy, that's a reality. And we've had 1.5 million deaths globally in about 10 months. That's a lot of deaths. In BC, 1,800 people have been hospitalized, almost 500 have been in the ICU, and we've had 550 deaths. Those are pretty astounding numbers for a new disease over a 10-month period. So I think it's important just to stay with the facts and when discussing these types of things, and recognize that also that a lot of the steps that have been taken to control COVID and control the pandemic up to this point in time are having some negative consequences on people and having an impact on the way they think about things. It's causing unemployment and financial challenges and disruption of education and things like that. And these consequences aren't affecting everybody equally. But on the other hand, if we didn't do it, some of these control measures and immunization and requiring masks, then we would have basically be left with unacceptable loss of life, and unacceptable secondary impacts of COVID illness. And we'd have an overwhelmed healthcare system, and we'd be left making some very, very difficult decisions around things like who gets, into the intensive care unit and who gets onto a respirator, things that, decisions that Italy had to make back in the spring. So we need to have a balanced discussion about a lot of these things. And I think, my main message, and I'm being a bit long-winded on this, but my main message would be that we have an opportunity now with the vaccines coming to bring an end to both these negative unintended consequences and the direct consequences of the virus. So the vaccines, I think, are a really good option that we have. And again, we're not likely to have them be mandatory, but we do need probably somewhere in the range of 70 to 75% population coverage in order to have herd immunity, where the virus is less likely to spread in our populations, so that we basically see a stop to the pandemic.
Thank you. The new health orders that just came out this week talk about these restrictions going on until early January 8th. And you mentioned when you were speaking about the effects after Halloween. So those social interactions, the travel, the ripple effect afterwards. What is the South Island anticipating around the after effects of the holidays coming up?
Well, we're concerned about it. The medical health officers on the island are quite concerned about that, because we, saw the very rapid spike in cases after Halloween, and people are having to think right now, what is the holiday season coming up going to be like, for me, if I'm not seeing my extended family. It's going to be a different holiday season for all of us. And, I've been talking a lot with our long-term care program and long-term care facilities, and it's devastating for these facilities, for the residents in those facilities, not to see many of their family members, and it's devastating for them to think about not going through a holiday season without seeing their family members. So as much as we can, we need to be thinking about doing things virtually this year, and it's not forever. It's again, we're seeing the light at the end of the tunnel, and but if we don't do that, then the consequences of having a major third wave in January are quite high and could be quite severe for us.
Thank you. Oh, all right. This is a personal question for you. You're dealing with COVID every day. You're right in the thick of it all. How are you taking care of yourself and the people that you work with? It must be difficult to be in the position that you're in, and Dr. Stanwick's in, and Dr. Henry's in right now, in the decisions and the work that you're doing.
Yeah, well, I think it's what we trained for. We've talked about pandemic planning for decades, and it's the kind of thing that we do, and we're well prepared for it. Planning out emergency mass immunization programs is something that we've done before with the H1N1 pandemic, and so we're prepared for it. And I think we do have to have a bit of lighthearted humor and activities. We're not all in the office every day, and I'm not there today. But today in my office, there was a Christmas cookie decorating, activity going on, and people made up some very, very creative cookies and iced them up with different COVID type of things on them. So that those type of things I think really help. Having some lighthearted fun around different things that you can do is important, and then obviously maintaining physical activity and maintaining hope about the future that we have coming out of this pandemic in the not too distant future.
Exactly. Dr. Fyfe, I know that you're ready to jump onto another call, and I think that might have been it. But we'd like to thank you so much for taking the time with Camosun College today. We really appreciate the work that you and your colleagues are doing to keep us all healthy and safe, and I appreciate you being here with us today.
Thank you, Sherry.
So much.
It's a pleasure, and best wishes to everybody as we come into the holiday season, and a different holiday season it will be. Thank you.
Absolutely. Happy holidays. Thank you so much. And now it's my pleasure to introduce to you our wonderful board chair, Dr. Monty Bryant, who is going to say a few words to you as an opening. And this time we have him live on screen. If you were at the last one, we could hear Monty's voice, but we couldn't see him. So now you get both. Over to you, Monty.
Thanks very much, Sherry. Actually, thanks to Rodney, Tyler, the IT staff. Everybody's working hard to make sure that I was able to be seen today, never mind heard. It is a pleasure for me to participate in my second virtual gathering. These past months have been very challenging for all of us, both in our work and our personal lives. We finally see some light beginning to be seen at the end of the tunnel. Thinking of Churchill, it's not the end, but it's the beginning of the end. We have some good news around our international students, our domestic students, which you're going to hear about more today, I'm sure. We've got the 50th anniversary coming up that we're pretty excited about. And of course, the best news is that we're hearing some positive things about vaccines. But a sincere thank you to all of you. This has been really challenging, and as faculty, support staff, administration, thank you for your phenomenal efforts to maintain services to students. These, as I said, it's been hard enough, but under these circumstances, it is phenomenal. Thank you.
Thank you so much, Monty. I'd like to just say a huge thank you as well. A huge thank you to all of our employees that have joined us today, and then the ones that aren't on the call today. This time of year is it's exam time, it's final assignment time. It's where sometimes you see dogs on campus. Everybody kind of pulls together to make sure the students make it through. And I know everyone is still doing that. People are working very hard to ensure that our students are having the very best experience, both educationally and support-wise, that they possibly can. So I'd like to thank everyone for that. And I just want to talk a little bit about a question that was sent in about, can we pay people extra? Can we give some folks bonuses for all of the extra work that they're doing? And I really wish I could. I wish I could provide, I don't know, days off and extra funds. That isn't possible. And it isn't possible for a lot of reasons, but the main reason is we're part of the public sector. And as such, the public sector employees council, sets the rules around things like benefits and salaries. And so we are part of that. And unfortunately, we can't. So, I hope when I say thank you and Monty, our board chair, says thank you, that you take it with where it's coming from. It's coming from here, and we really do thank you for the work that you're doing. I know too that you're supporting students in whatever job you have at the college, but you also have families and children. Some of you, there are loved ones in other parts of the world. This is tough on all of us. And we're at the time now where I think we're all ready for a break. And I really hope that people get a chance to just really relax when you have the time off this year, and spend it in a really positive way, the best way that you possibly can. In January, we're going to start in what I'm calling building forward. What did we learn from the remote experience that we've had? What will we keep? What will we get rid of? How will we move forward? And so conversations will start happening across departments, divisions, across the college about what did we learn and where are we going? And I'm calling it building forward because I don't think we want to build back. We've been changed. We've been changed as a college, as a society, as a world. So we'll look forward to conversations about that once people are rested and are back in 2021, as we look forward to the vaccine and the changes that'll take place then. So I'm going to pass it over to Rodney, who's going to facilitate the questions that came in advance. So thank you so much. Over to you, Rodney.
Hi, Sherry. So during this virtual gathering, we had just over 500 people participating in June, and then in September there were just over 400. The purpose of today's virtual gathering is to provide an update while addressing questions. We've got the college executive on standby. First of all, we're going to go through the pre-submitted questions that had been submitted in, and then we're going to get to the chat function. So just to kick things off, and hopefully we'll go to gallery view for all members of CET. We're going to kick things off by going back to Sherry, the college president. Just to ask Sherry, what's the current deficit situation, and has the college approached the ministry with regards to financial assistance?
Thanks, Rodney. That's a question that I'm asked quite a bit, and I'm sure Monty is as well. So right now, we are projecting just over a $5 million deficit for this fiscal year. And whether it may grow higher, it'll depend on our enrollment in January. We are hoping that our domestic students start or continue to join us, and I don't think our international numbers are going to go up substantially. We're just hoping that we don't lose international students over the holidays. So we're looking at about a $5.1 million deficit right now. Could go up to $7 million depending on what happens in January. As far as conversations with the ministry, yes, there are constant conversations between ourselves, members of the executive team, and the ministry. And the ministry's approach is going to be sectoral again, that we have 25 public post-secondary institutions in British Columbia, and our ministry will be going to Treasury Board and asking for approval for us to carry a deficit into the next year. Now, that puts us in a very awkward position to start a new fiscal year. We don't anticipate getting bailed out. So in other words, no money coming our way, but we will be allowed to carry a deficit, which right now by legislation, we are not allowed to carry. So we anticipate that coming in the new year once government's up and running. So that's about all I can share right now. And I'm sure we'll hear when we'll make it very well known when that has happened. Thanks, Rodney.
Thanks, Sherry. I'm going to ask Jeff Wilmshurst. He's the VP Partnerships. A couple of questions. Jeff, just starting off, could you maybe provide an update on how international enrollment numbers are looking for the next semester?
Thanks, Rodney. Very happy to do that. Our international numbers for January are looking very similar to those that we had in September. It's, believe it or not, still early because students for the January semester make decisions later. And so what we're monitoring now are looking at the students who have been with us in September. Are they going to stay with us into January? Of course, it's been difficult both for domestic and international students to be largely online. And so I'm sure that there are students evaluating whether that's something they want to continue doing. But our monitoring is indicating that, our numbers are looking pretty good. And what I want to say also is that we're putting a real emphasis and focus on what we're going to be doing in September of 2021 in terms of recruiting students. So we're actually moving into that whole recruitment world now for September, and we have a really major plan to get significant enrollments in September of 2021 to get our numbers back to where they were and maybe exceed where they were in previous years. So that's where a lot of our attention and effort is now. We're really hopeful. Of course, there's things that are slightly out of our control in terms of vaccines and air travel, et cetera, and visa applications and visa processing. All of those things are things that are out of our control in terms of being able to recruit and successfully recruit and see students come here next year. But our goal is to see a real return to our international numbers.
Thanks, Jeff. Second question that would fall under you is one person was looking for an update about when both bookstores will open, and also is there any timing specifically around when Lansdowne bookstore might be opening?
So the Interurban bookstore is currently open, and I know that there were lots of really excited people, and I'm just looking at the schedule here. I got to put my glasses on so I can see it well. So the Interurban bookstore is open from 11 a.m. to 3:45 p.m. To the public and for web order pickups from Monday to Friday. And the Lansdowne bookstore is open for pickups from Monday to Friday from 1 p.m. to 3:30 p.m. I know that people are hoping that the Lansdowne store will open to the general public in the new year, but that is not the plan currently. Our plan is to maintain the store at Interurban for opening to the public with hours, regular hours, Monday to Friday, which will be posted, and also for web order pickups for the Lansdowne store on regular hours that will be posted soon. As soon as we are able, we will open the Lansdowne store, but currently our efforts are to provide the best service we can through our Interurban location. And as things begin to allow us in terms of the pandemic to open up more, we will. So that's the answer I can give you now.
Okay, and of course, 50th anniversary merchandise is available.
That's right, Rodney. And if you come in tomorrow and you buy a 50th anniversary mug, what will you get?
I don't know, Jeff, tell me.
50th anniversary mug.
Okay. Okay, moving along. Thanks very much, Jeff. Moving along to Heather, VP Student Experience. There's a few questions came in relating to Heather, your division. We've got a couple of questions related to surveys. One was about the college's student survey, the status of that, and another is about surveying students about their online learning experience.
Great, thanks, Rodney. So we are in the middle of an administration on a student check-in survey. Many of you probably have heard me speak on a check-in survey we did back last June, just to ask students how it was going. What's it like being in this remote environment? Were they accessing services? How are they accessing services? And any feedback they might have for the institution. And at that time, my leadership team and I looked through those results. And we made quite a few changes to the way we deliver services. And that's one of the reasons you'll see the service model that we have right now, where we've got student access that's email, phone, or video conferencing. We've added a whole bunch of self-booking tools, etc. So we decided to do that check-in survey again, but expanded a little bit with the guidance of Sybil Harrison and Ted Cannell to really look at students' use and access to technology. We have been loaning Wi-Fi devices, laptops. We know we've been opening up spaces inside the 2 libraries because students are looking for study space. So we really wanted to get a handle on what type of access are students looking for, what do they need, so then we can build the right supports and improve that part of how we support the student experience. So that administration is going on right now, and we will be getting those results. I'm going to assume in early January, and we'll do what we did in June, which is analyze the results and share them with our team so that we can improve student access to services. In terms of the learning experience, we have not done a survey, but we know that there are so many faculty who have been really following a best practice, which is trying things out in their classroom and then asking their students, how's it going? Do you like this? And that type of instant feedback has been going on. We continue to encourage our instructors to do that, because that's where you're sort of going to get a quick and accurate feedback from those who are experiencing the learning experience on how things are going. But we do not have a plan at this time to do a larger survey, and simply because there's so much diversity between the many programs. So we encourage you to do it within the classroom.
Okay, thanks, Heather. Another question is about counseling services. How is the college ensuring that it is supporting students' mental health needs, particularly at this time?
This is a really great news story for the college. So over the summer period, the counseling department changed its service model to what we're calling the rapid access counseling model. You might have heard our chair, Lisa Robinson, who was interviewed for some media talking about that. But the new model allows us to see students literally within 48 hours. The vast majority can be seen same day. And where we have some backlog, and as you can expect, the numbers of students reaching out for mental health support has been increasing as our days have been getting darker and the rain has been falling. But we are able to see folks within 48 hours. So we believe we're being very, very responsive to the students' mental health. And we'll continue to monitor it as we do. We follow, I guess, a practice of continuous improvement. We keep checking in to make sure that students have access to these services. And if we start to look that we're creating long waiting lists or long wait times to get in, we will regroup and look at how we can improve access again.
Okay, thank you very much, Heather. Barb, moving on to, we've got 3 questions relating to human resources, and we've got Barb Severin. Barb is the Executive Director of Human Resources for the college. Barb, the first question is around the college's mental well-being support plan. And we got one person, they said they appreciate the effort the college is making. Where will they be able to submit ideas about additional actions and things that the college could be doing to support mental health?
Well, thank you, Rodney, and thank you for the question. I'm delighted that people are hearing about the Employee Mental Wellbeing Plan. It was launched on November 23rd. And the beauty of the plan is that it's flexible so that it can accommodate additional ideas and modifications as we're rolling it out. And the intention is that we have programs and workshops and offerings right through to the end of June, at which point we'll do a full evaluation of the success of the offerings that we've had to date. People can go into the Healthy Together website and have a look there, and any ideas can be submitted through through HR, through myself, through Daryl Thompson. And we are really looking to respond to the needs of our employees to support them through these difficult times. So we'll appreciate suggestions and input that people have.
Okay, thanks, Barb. The next question is around masks. What's the college's approach to employees who don't believe the virus is real or decline to wear a mask while on campus?
Oh, thank you, Rodney. We heard Dr. Fyfe's response to that, and I certainly support what he said. What I will say is that where there's a medical reason, where there's a medical certification of an inability to wear a mask for whatever reason, then we're obliged to treat that as an accommodation like we would any other kind of accommodation. So that can take the form of working remotely if that's possible. If it's not possible for people, we look at finding other kind of meaningful work for them to do, or allowing them to use different leave banks and so forth to cover their absence while the use of masks is mandatory in the workplace. If it's a matter of choice, while we respect people's rights to their own opinions, it would be treated like a safety concern. If they are unable to meet the mandatory safety requirements, then they're unable to work. And we would deal with it in that kind of fashion. You know, I have to think about what Dr. Henry says around the choice of whether or not to wear masks. She says, if you choose not to, order takeout, shop online and stay home. So we respect people's rights to make those choices, but we have an obligation to keep our staff and students safe.
Okay, thanks, Barb. Third question for you is, will the college be able to provide employees with a stipend to help cover the additional costs of working from home?
Sherry addressed this in part in her opening, and we're not in a position to be able to offer bonuses or additional stipends. And we are doing everything that we can to ensure that people have all of the supplies and equipment that they need to be able to fulfill their roles while they're working from home. But there is a bit of a good news story in this. Recent announcement came out from Canada Revenue Agency, where they're revising their requirements such that they are going to allow employees who are working from home a deduction up to $400. In essence, no questions asked, to cover the additional costs of working from home. We don't have details on that. We are waiting for CRA to provide us with additional details, but that's at least one way that people may have to be able to recover some of the costs that are associated with working remotely.
Okay, thank you very much, Barb. Moving on to our next member of the college executive team is John Boris, VP Education. Hi, John. We've got the first question is, post-pandemic, after the pandemic, will the college allow faculty who teach asynchronous courses to continue to do so from home?
Thank you, Rodney. It's a great question and kind of an exciting one. I go back to Sherry's opening comments about building forward. And really, this question is one of those that we have to work through as an educational division, is how we keep the things that we've learned that allow us to provide a greater diversity of offering, which would include a stream of asynchronous or synchronous online delivery. We've certainly heard from some students that love the flexibility that's provided, and it really will be looking to the voice of students as we listen to what's worked for them and what hasn't, and being sure that we keep the good and improve on things that didn't work. So definitely we'll be looking at online learning, both synchronous and asynchronous, as part of our delivery plan once we're all back together. But nonetheless, I can't wait until we're back together.
No, very true. And when will faculty be able to officially use Zoom for instructional purposes?
I'm sure officially is a tricky word that in some way will catch me unaware, but our effort is to purchase Zoom and to have it available, but recognizing, and as Bonnie Henry has said, trying to be kind, the settled folks are needing time to really look at the software and understand how best to support faculty. So we'll make it available as soon as we can. And Settle is identifying that probably mid-January we'll be ready to more officially support it.
Okay, no, thank you very much, John. Just hopefully we're down to our last two questions that were pre-submitted. So please remember that to submit questions using the Q&A function. And hopefully if there's a question there, the way we're trying to do it to make it fair is that if you click on the little thumbs up, we are going to try to take things that are questions that people click on. So the last couple of questions that came up, and I suppose are homeless, with so many people working or studying from home, what will happen if extreme weather such as snow shuts down the college? So the college closures due to snow or other extreme weather is intended, first of all, to keep employees and students safe. In the event of campus closure, with so many students and employees working and studying from home, instructions and services will continue to be delivered remotely wherever possible. The second question came up, and this was a question about the type of ventilation systems that the college uses on campus. So facility services, advised that the college does everything it can to ensure that heating, ventilation, air conditioning systems are properly maintained. And there are various types of ventilation systems depending on what building you're in, what part of the campus, but they're all designed to follow follow WorkSafe BC requirements to provide a safe environment and ensure that the buildings are healthy. So that brings us to the end of the questions that were submitted in advance, and we're going to move on to the next segment to address questions in the live chat. Remember to click the thumbs up, and we'll see what we can do to address questions there. I know there were a number of questions had been asked, probably directed, well, they were directed to Dr. Fyfe. Unfortunately, we had very limited time with him, and given the volume of pre-submitted questions that came in, we did our best to answer those. I do know that at 3 o'clock today, the province was announcing its vaccination plans. So, you know, those are a lot of clinical questions coming in there, and hopefully the answers will be provided there. I know a lot of people will be tuning into that. So I suppose the question right now, the most popular question goes to Jeff. The question is, can people buy Camosun branded face masks for their friends and family?
Oh, that's a good question. We do have Camosun branded face masks. In fact, I think, Rodney, this is a pretty good question for you too, because I believe that you are some of the keeper of the branded masks. We'll look into that. We'll look into seeing how we can get access to these masks and make them available so that when you come in to buy your branded coffee mug, you can at the same time buy your branded mask.
That's a good question and a good stocking stuffer. Another question coming in, again, that's not, will internet terminal loans be extended to next semester? I suppose I'm not too sure who would best be positioned to answer the question about internet terminal loans.
Probably Heather.
I can't answer that question right now. If we're speaking to the Wi-Fi devices that we made available for students to borrow through our partnership with BCNet and Shaw, I know it was for one semester. I know that there is a meeting tomorrow to discuss whether or not we can continue that program and what would be involved. So if we are able to do it, we certainly will be looking at ways to do that. I'm just not sure and can't answer that right now.
So Rodney, I think that's a Cam News feature, both the masks and that question.
Yeah, no, for sure. Another question coming in, will there be any consideration of QP staff working from home once the college fully reopens? I know that's come up before. Barb, from a HR perspective?
I think that's something that will be part of, John was talking about the building forward, and it will be part of a larger discussion that we'll have. The arrangements for working remotely right now are temporary and in light of the COVID pandemic. And there are things that we need to discuss at greater length. So I'm not in a position to make any commitments around that at this point in time, but it's certainly among the things that we will be looking at and discussing as we move forward.
Okay, thank you, Barb. So a question about the college moving to Zoom. Will instructors, sorry, everything's jumping very quickly. Why is the college moving to Zoom, and will instructors be able to continue using Collaborate after the transition?
Go
So
ahead,
I
John.
just answered it. We are still supporting Collaborate. Zoom is just for those who are comfortable and wanted to add that to the group of tools. If you are comfortable using Collaborate, and Teams, continue to do so.
Great, thank you, Heather. Actually, this will save me a Cam News piece. The person who asked regarding the Wi-Fi connector, the connectors, Sybil has answered. So laptop loans will be extended, and also Wi-Fi for as long as we are able. So thank you, Sybil, very much. Is the holiday planning a virtual holiday social gathering? Sherry, do you want to take that one?
Sure.
Or?
No, there wasn't a plan to do a gathering, a social gathering. If you've been to the past few that we've had, they've been held in the Trades Building foyer, and last year was in the new Alex and Joe Campbell building. A lot of people come, and I'm not sure that that we have the ability to make it social. I think some departments are doing fun parties and games, but the college as a whole, no, we'll just have to have a really good one next year.
Okay, thank you. Another seasonal related question. Should departments be purchasing Christmas gifts for staff, faculty, students?
If they're paying for them themselves, I suppose it's Christmas gifts isn't part of, I give Christmas gifts, but those are gifts from me, not from the college. So I think that might be the question is should people be using their department funds to provide gifts for the employees? And the answer is no now, but it should be no all the time.
Okay, thank you. Also, just wanted to come back to the Zoom questions we're getting around Zoom. Additional clarification is that ITS will be supporting Zoom initially, not Settle, and that's part of the phased rollout. Thank you, Martha, for that help. Question coming back to, I think we answered this, Barb, before, but questions coming around, can people claim deductions for home office space?
I'm afraid I don't have the answer to that right now, but we are looking forward to getting more clarification from CRA, and we will share it. We'll find ways to make sure that people have that information. It really is a Canada Revenue Agency issue and not anything that we're responsible for. So.
Okay, thanks, Barb. Another question, is regularization of eligible term faculty suspended for the time being?
That's a John question.
Yeah,
Sure. We have collective agreements and we will continue to follow them. So even in the state of a pandemic, collective agreement obligations still continue, and we'll be following those just as carefully as we always do.
okay. I suppose this question actually came up, not a different, unrelated question. Are support staff able to get a Camosun mask for use while working on campus?
I think we can make that happen. That sounds like something we should.
Yeah, we do have facilities ordered, quite a stack of them for people that were working on campus. So if you are working on campus, all you need to do is ask your supervisor, and you should receive a mask from the college.
Yeah, I think I can add to that. It was in Cam News a while ago, and while supplies last, people are being given one reusable mask, and then disposable masks can be obtained by going to facility services for employees coming on campus. Looking back into the questions, the question came up regarding will vaccinations be mandatory as a condition of returning to campus? I'm not going to try to answer that again because Dr. Fyfe answered that
You did.
regarding, so I'd encourage you to go back to the recording of the video and watch the Dr. Fyfe segment. And just there's a lot of questions about the laptops loaned to students. Do they have a mic and camera? I can't see that. And that's not that's yes. Julie Oakley has confirmed from Facility Services you can get masks from the administration in your department, and masks have been distributed already to departments and schools. So thank you for the policing of the questions and answers.
So, and a huge thank you to people that are writing answers in that we
Yay!
can't answer. So well done. Thanks, Julie. And
Yes.
Sybil. Martha.
We've got time for a few more. So our students who are attending on campus weekly being offered reusable masks. So I think going from the answer before from Julie, masks have been distributed to departments and schools. So students coming on campus should speak to their school, their instructor with regards to accessing those masks is what I'm seeing as the answer. Again, that was courtesy of Julie Oakley. And college laptops do have both cameras, both a camera and a microphone. Thank you, Ted Pinnell, for your support and for helping answer the questions that we don't know. Looking to see if there's anything, will there be data collected on drop rates? This is a drop without academic penalty, and switches to audit this year be compared to prior years to gauge potential student loss due to the online environment. This is recognizing that students drop for other reasons, but it might be interesting to see those results. I hope I read that correctly.
Heather, why don't you answer that?
Well, we have been tracking data on our students. I know that a number of weeks ago, we were comparing the number of students who withdrew as a percentage compared to last year, and we actually did not have an increase in the withdrawal rate. So we will be looking at that just to look at the overall impact. I can't answer the question right now, but certainly we do look at our data, and we will be looking at that particular factor.
Okay. Thanks, Heather.
John, did you want to add something to that?
Yeah, just it was interesting this morning, a meeting with the ministry identified that they've actually done a look across the province for just that question. And actually, drop rates are not appreciably different than in previous years.
It's interesting.
Across the province,
Yeah.
including us.
Okay. Well, if people have questions about laptops, you can email laptops@camosun.ca. There's still some questions regarding the masks. A lot of chat about that. For example, the School of Health and Human Services have made the masks available to all students. Sorry, question coming through. When will we have access? When will we have access to the 2020 CUPE faculty and BCG-EU collective agreements on the HR website? Barb.
Well, there's a, I wish I could say we're trying for before Christmas, but there's a process whereby they get proofread by the union, by HR, and then by PASEA. And we're in sort of multiple rounds of that right now. Once they're finally endorsed, they will be posted. But we're in the throes of that proofing process, and as changes are made, they have to go back through through the same steps again. We are getting closer, so it should be soon.
Okay. Just looking to see if there's any questions that we can address. Questions around masks coming up, we're answering. A question around international students. International students don't receive textbooks until weeks into their course, 4 to 6 weeks. Is there any way to expedite that for the winter term?
Yeah,
Jeff?
we're trying to get on top of that. We recognized that in September that was an issue and so we are trying, and I know Dahlia and the bookstore team have been working extremely hard to ensure that our students who are overseas are going to get their textbooks on time. So that is the plan.
Okay, noting that we're at 3:55. I think that perhaps one of the last questions we're going to get to is why was there no extension on drop date deadlines? That's from faculty, so maybe John.
I'm not sure of the question. Maybe repeat it.
Certainly, absolutely. Why was there no extension on drop date deadlines? So I suppose maybe what to drop out of a course. If I'm trying to interpret it too.
Yeah, because certainly we have made modifications to those dates in the past. And so I'm just a bit surprised by the questions. So I'll follow up on that, but we certainly have made those modifications in past semesters.
Okay, Alan, John will get back to you probably through Eric. I don't see anything else that we can answer other than the vaccine questions, which I've left up there. One last question. With the deficit, have all plans to move ELD, etc., to Lansdowne been put on hold?
Maybe I'll answer that one. I think, as you can tell, the intercampus moves have been kind of put on hold somewhat. We are reviewing the plan to see if there's any way we can save money. We also have some capital funds that that we have from government. We've received word that we must spend them by the end of next fiscal. So we're looking at all of those different aspects of that intercampus move, the campus plan, and then our capital funds that must be spent, and see if there are any modifications. So as far as access moving to Lansdowne, right now it will proceed at some point, but at the same time we're reviewing all aspects of it for funding and financial issues.
Okay. Thanks, Sherry. I think that wraps up the chat questions and answer session. So again, thank you very much to everyone who submitted a question in advance. Hopefully we got to it. I think there's one question in the Q&A that we're going to get back to, Alan. And I'd like to thank members of the college executive team for your patience and participation. I'd like to turn things over now to Board Chair Monty Bryant and to our President Sherry Bell for some closing remarks.
Thanks, Rodney. First of all, I really appreciate the opportunity to participate in today's virtual gathering. One of the things I'm most proud of is being part of an amazing organization that is defined by its focus on learning and its caring for students. Yesterday, I helped to deliver some of the 108 hampers to students, yet another example of the support that's provided students. So in conclusion, thank you all for your efforts. I wish you all a well-deserved break, a safe and happy holiday season, and hopefully a much happier new year. Thank you.
Thank you so much, Monty, and thank you for being here again. Everyone, college community, I said it at the beginning, I just, from the bottom of my heart, I want to thank you and hope that you have a holiday season that is restful, peaceful, that you can have some fun, at the same time rejuvenate and recharge, because this has been hard for everyone. I hope your families stay safe and healthy throughout the season. And I'm really looking forward to seeing people's real faces in 2021. Please take care of yourselves, take care of each other, and thank you for joining us today. Happy holidays.